Well, on to the other big story that we're tracking, which is Kerala. Now, while, of course, India's numbers continue to dip, Kerala continues to be a cause of concern. Kerala has been reporting the highest daily COVID-19 cases in the country for days now. The positivity rate, or the percentage of how fast an infection spreads, is 12.48% in Kerala. I'd like to reiterate, the test positivity rate in Kerala is at 12.48%, while the national average of positive cases in India is 1.9% according to the government data. Now, the state government says that COVID-19 cases in Kerala are at a plateau, and the current numbers that Kerala is seeing were not unexpected. The government says, however, that testing and contact tracing in Kerala continues to remain a cause of concern. To talk more about the Kerala story, we have with us Dr. Riju M. John. He is a professor at the Rajagiri College of Social Sciences in Kochi and also a health economist, guest faculty of the IIM Kozhikode. Thank you so much for being with us. I want to begin by asking you, Kerala at one point in time was touted to be the model state. And now we are seeing an unprecedented rise in cases in Kerala, the positivity rate crossing 12%.
Yeah, that's right, Ms. Muribata. Thank you for having me here. Yes, you're right. I mean, the health test positivity rate has gone up to 12.5% yesterday, but that's just a one-day figure. I usually look at the 7-day average figure, which is at 10.9% last 7-day average, as against, of course, 1.8% Indian average. So it's almost 6 times higher than national average, which is a clear cause of concern. And it's pretty clear when you look at the contribution of the state to the national numbers. It's quite worrying in the sense that, if you look at the last 1 week, Kerala alone has contributed to 43% of the new reported cases in the country, whereas the state has only contributed to 7.5% of all the tests done in the country. So there's a huge discrepancy in terms of its relative contribution to the number of cases versus the test. So clearly, the testing is at a very low, and the state needs to increase that quite a bit.
Right. Dr. John, you of course have been crunching the numbers on this. But I mean, when you say it is 6 times higher, you're saying that the 10-day average in Kerala is at 10%, whereas the country's average is at 1.8%. What would you attribute as the major reasons? Because the big cause of concern here is that the testing in Kerala is also between 40,000 to 60,000, whereas the centre says it should be around 1 lakh.
Absolutely, I agree with that. I mean, right now in Kerala, the daily average testing is around 55,000 per day. And, in fact, this is a little bit lower than what it was back in October 1st and 2nd week, when the state was actually having the peak of the pandemic, the initial peak. At that time, the daily testing used to be 61,000 on average per day, and now it's down to 55,000. So, in fact, I believe, having demonstrated that you can reach a certain level of testing, like, you have already shown that you can do 61,000+ daily tests, and why are you not doing that? I mean, you should ideally be increasing it. I agree that daily testing has to go up more than 1 lakh per day, but it's only 55,000 or so. It has been quite steady at around 55,000 mark for the last more than a month or two now.
Right.
So that has to change, and the daily testing has to rapidly increase and go up more than 1 lakh per day.
All right. So low testing is, of course, a cause of concern.
The low testing, of course, means that, low tracing, and, of course, the testing is there's no substitute for testing as such.
Yes.
So you have to do that, you have to increase it. And of course, the higher test positivity rate, I mean, it's just a mathematical number.
Yes.
You have the number of cases reported divided by the test. So if you have lower test,
right,
obviously it means a higher test positivity rate.
Right.
So there's no substitute to, decreasing that. You have to bring down the test positivity rate, and that means you have to increase the testing much more. And given the high test positivity rate, it would also mean that you're not really finding out a lot of cases, means you're actually missing out, yes, a lot of cases that are out there.
But what according to you, Dr. John, is the reason? Because Kerala was touted to be, the model state, the example that the country should follow. And now it's the other side of the anomaly at a time when we're seeing India's cases dip. One is seeing Kerala stick out like a sore thumb.
Well, it's difficult to say what is the correct reason behind.
Right.
But I can only speak about the numbers that I see, right? So what I see is that the testing has really not caught up. I mean, the percentage growth in cases is actually higher than the percentage growth in test on a daily basis. So that should not happen. Of course, you're right. I mean, the initial phase of the pandemic, Kerala was touted as the model to follow. But, unfortunately, in recent times, the state could not, cope up with the increasing rate of cases. I mean, and I believe, it's not the state only to be blamed. The state is not the only one to be blamed, of course. Because there has been a lot of heated political activity. We had recently concluded local body elections, which saw a lot of people on the streets. And, now the state election is going to happen in April. And that's also going to see increased, public or people movement across. And so obviously with these things impending, I see that the cases are not going to go down immediately, but what state can do is to really increase the test much more and as much as possible try to isolate the cases.
All right. So,
but then, to be fair, I mean, the state has also been maintaining that, the ventilator capacity and ICU capacity is not being used much, and there's quite a few capacities still remaining. And the state really maintains the position that, the pandemic is under control, even though the numbers looks very large in comparison to what is happening in the rest of the country.
Right. How concerned are you, given the fact that there have been 150 cases of the UK strain being reported in India? We now know that this strain is not just more contagious, but also more deadly. What's your assessment? Do we need to test more positive cases in Kerala, perhaps for the UK strain as well?
Well, in Kerala so far, about, if I remember correctly, a couple of days back, about 10 UK variant cases have been identified in Kerala, only about 10 out of these 150 that you're talking about. So clearly, when you have a higher test positivity rate, that would mean that there are more cases undetected out there. And if, if some of those are these UK strains, which is known to be fast spreading compared to the previous strains that we have, that is a special concern that we have to address.
Right.
So increased testing is the way to go for that. You have to identify as many cases as possible, and that has to happen through increased testing.
All right. So perhaps the only way that Kerala can tide over these times is by ramping up testing and contact tracing, something which a lot of experts have in fact talked about. But thank you so much, Dr. John, for joining us and breaking down and explaining some of those numbers. Kerala at the moment is a state which is seeing a positivity rate which is 6 times higher than India, and we've hoped to sort of break down some of that data for our viewers. Thanks so much for joining us.